a lot. Okay. Okay. Yep. Let me just make it full screen. Shall we start now, or we are expecting more people to join in?
Well, normally we average around 15 to 20.
Or 15 to
But
20.
right now it's only sitting at 5 to 6 of them. I'm not sure. Can you guys
Mm.
text the rest to join, please?
Are they all students here or academic
So
staff
they're
as well?
all at the moment all students. So these are all, I think, the GS. Think yeah, most of them are the GS students, and
Mm-mm.
so they're all master postgraduate level, and they're
Okay.
probably applying for their project ethics. Yeah.
Okay. Okay. I
I
try to
mean,
make it
even if
something
it's
more.
neurosurgery, it'll be the same, and yeah,
Yeah. I try to tailor something that fit their context as a student doing their project also. Yeah.
yeah. Thank you.
Okay. So
Thanks.
meanwhile, maybe I can start first, since it's a recorded session because I have another meeting at 4.
Yeah,
So
sure.
yeah, I guess
We need to keep
probably,
the time. Yeah, just please
yeah,
do that. Yeah,
yeah.
thank you. Yeah,
Thank you so much. Yeah.
thank you.
Yeah, thanks, Gauri, Prof. Retna Gauri, for having me today, for this talk about ethics committee. And also maybe I can share you some tips on how to apply your ethics clearance from UMMC Ethical Research Ethics Committee. So yeah, just a very brief introduction about myself. Yeah, so I'm currently the senior lecturer from Department of Pathology. So besides that, for administrative role, I'm actually the secretary of this ethics committee in UMMC, and I'm currently heading this unit as well under UMMC. I'm also helping University of Oxford to do some research under the umbrella of Global Health Bioethics Network. Okay, so I think some of these slides may not be relevant to your study, but I think it's good for you just to understand the general information about ethical principles. And after that, this will also help you to shape your proposal that you're going to submit for the ethics clearance. Okay, so I think this is the very first time I have been invited for this I think surgical research week that you are talking about all the research things. All right, so yeah, just some background that why do we need this ethics committee in place to govern all these research activities. So if we look at the historical background, like those very famous incidents, I'm not sure whether you aware of these incidents, but definitely I think you know that during World War One or two. So there are a lot of human experimentations ongoing, and how these people has been treated inhumanly for clinical research. So therefore, I think after all these incidents happen, and we come up with a lot of these ethical principles and also the guidelines to help the researchers to do their research in a more ethical manner, and at the same time to ensure that science still earn the public trust, because of these historical tragedies that also tarnish the good name of the science and medicine, that people wearing white coat, they can do whatever they want, but after all these incidents, and we have come up with a lot of different guidelines, but I think principally um the the essence of having all these guidelines is to help the researchers yeah, to do more ethical research, so like how to take consents and all that. Okay, so these are all the guidelines that currently we adhere to. So if you are doing some clinical research engaging human subject, then I think you are quite familiar with this ICH-GCP, which is a good clinical practice for those researchers who would like to do some interventional studies. And also another good latest guidelines that I would like to share with you is SIOM's biomedical guidelines. So in these guidelines also, it helps you to understand better what are the international standards primarily set by WHO what are the best standard on doing clinical research or biomedical research. So if you have time, you can actually go through these two main documents. So one is ICH-GCP and the other one is SIOM's biomedical guidelines. And all these two guidelines actually are built based on the previous three. So Nuremberg Code is actually the principle of ethics that come out after the World War. Okay, then after that, there are quite several more events, unfortunate events happen, then they come up with all this Bellman and also Declaration of Helsinki. I think nowadays we still using Declaration of Helsinki as one of the gold standard for biomedical ethics, and this is the one that keep updating with different needs. And I think the latest one should be in 2020, if I'm not mistaken, that they have more updates regarding genetic research and biobank, something like that. Okay, but nevertheless, if you're keen to know more about all these ethical guidelines, so I think you can go with this GCP and also the SHRMS guidelines. By the way, if you have any question, you can just type in into the chat box. So after the session, I can answer to your questions. Okay. All right. So this is what I actually talking about because of the previous incidents that blemished the image of biomedical research. Okay. So therefore, it's very important that we have forms certain things to govern medical research. Okay, and this is about Declaration Helsinki and how it actually started since 1964, and is still up to date with different revisions and all that. Okay, so I think this is a very important information that why we need to have all these ethical principle is mainly to promote and safeguard health and also well-being of the patients and or the human subjects in your clinical research. Okay, so we want to make sure people they recognize, they appreciate the contribution of having this science and medical research, but at the same time to make sure all these things has been monitored well lah. So basically, if you look at the Declaration Helsinki, it did mention the importance of benefit and risk analysis. So you must make sure that the benefits should outweigh the risk. Okay, so whatever research you do, you must always think about what are the risks and what might be. If there's no way that you cannot avoid, and then you need to think about how you mitigate the risk and try to offer maximum benefits to the subjects. Okay. And then there are quite a number of things like, for example, we also look into the qualification of the researchers, whether that person is qualified to conduct the research. Like, for example, if you are the surgeon, right? So you might not be able to perform pathological examination, like, for example, doing some histological work. So you need to, if your study has something to do with all this microscopy work, like, for example, then maybe you need to engage the histopathologist or the pathologist who are qualified to do the work. So in one research team, usually there will be like multidisciplinary lah, because you want to make sure everyone can contribute their qualified expertise to the research and make sure that not that one person can do everything. Yeah, like for example, nowadays we have a lot of AI research. So AI healthcare research. So it's related to healthcare. By the way, we don't understand the computer science aspect, and therefore we need to get the right person to do that work. Okay. So and always we need to make sure that the researchers who are always play as a role as clinicians, also you need to be very clear when your action I mean towards your patient is because of your role as a clinician or your role as a researcher. So you need to be very clear cut. And in many situations, I think sometimes it's quite difficult. We do understand, like if you see your patients and how you actually approach them. So that's actually some guidelines for you to follow. Otherwise, it may cause some like conflict of interest. Like for example, you are getting your own patients to be your subject at the same time, and because of the trust of the patients to their clinicians or to their doctors, and because the belief that doctor will do good to them. So definitely, I think when you offer them something, even though it's still it's a trial of study, the patients might believe what you say and agree to be recruited in your study. So therefore, we need to make sure all this line has been drawn appropriately. And also, I think in many clinical research setting, also people always argue the use of placebo, whether what is the best approach or ethically sound to use placebo. So these are the things that we need to think about. If you already have certain standard of care there for the patients, and why do you still need to use the placebo in your study, and you will subject more harm to the patients, right? So you need to think about when you want to use the placebo. So we have noticed actually some student project also sometimes they overlook their objective, and that's already existing methods uh available. Then why do you still want to use placebo, right? So we cannot subject the patient to certain which is unacceptable lah. Yeah, okay. And also I think it's our obligation as a
Is
researchers.
your slides moving or is it still on
Yeah, I'm
Helen?
still talking about this slide
Okay, yeah,
actually.
sure.
Yeah.
All right.
So actually I'm on the this point, subjects should have access to therapy at the end of the study. So I just gave some idea lah why we need ethics. So these are the consideration. Okay, so
Yeah, sure. Thanks.
now I'm on the point that the researcher also having the obligations to ensure the post-trial access. Like for example, after you finish the study, so if the subject they respond well to that treatment or some procedures, then you need to think about how you want to continue this treatment. Even the study has finished already, then you need to negotiate with the sponsor or whoever that offer this study drug to the patients to make sure that they are not getting good treatment after the study. Okay, so another main aspect of ethic is looking into the publication, whether it's truthfulness, and then also to make sure all the research has been peer reviewed lah. Okay, so I may not go through very detailed. So therefore, the main person that working on this ethics review is ethics committee. So in different countries, they may address them differently lah. Like in US, they call IRB. IRB means institutional research body. So yeah, so different university of different countries, they may call it differently, but they are still the same independent ethics committee. Okay. So and also just for your information, yeah, I just would like to talk a little bit the composition of ethics committee. Usually it will be composed up to 10 persons, and we will for the medical or health related ethics committee, for sure we will have the medical specialists, and then we will also have the layman, we have scientists, and then we have also a law person that can advise us any medical legal issues. So I think it's very important that the ethics committee always reflect the local community, because we will have the public representative that sit in the ethics committee. So they will look at the study that is going to deploy on the public or the patients, and whether they see this is a good move, or that if there's any potential harms to the subjects, then they can voice out, they can advocate for the community. So ethics committee is not like some people think, oh, it's just all the senior experts, senior professors. All right, it's a mixture of different kind of members, and even gender also, we want to make sure it's a gender equality, that we have a balanced number of male and female. Okay, and even those people that review the study also, we need to make sure that person is competent, not only in their expertise, but also having some proper training in ethics as well. So otherwise they may not able to gossip and also to discuss what are the they may not, if you are not trained in ethics, it's very difficult. If you are just the expert in your field, so it's very difficult for you to deliberate those ethical issues lah. Yeah. Okay, and these are the very important principles of research on human subjects. So yeah, we always respect for the dignity of the person. So this will be done through informed consent process lah. So for your project, always you must tell from A to Z what are you going to do with your project. If that person agree upon to be recruited in your study, um, you cannot just simply tell them, okay, I'm going to take your blood and this is what I'm going to do, and that's all. So you don't, so that's why we need you to come up with a proper information sheet. You need to brief them according to what you have been written on your participant information sheet, to ensure that first is all the information has been delivered appropriately to the subjects. Okay. Secondly is to make it something layman understanding, because sometimes you want to do some very technical or medical things, and you may tend to use a lot of technical jargons to explain to them. But please always treat them just like when you're talking to your parents who may not know very well about all these technical terms, so, or your siblings. So make sure you explain in a way that people can really understand before they give you the consent to be recruited lah, or participate in your research. And always be sure that they always have the right to refuse or withdraw from the study without repercussion lah. It means that if your patients they agree to participate in your research, then at one point maybe they feel uncomfortable because maybe they cannot commit due to their work, or they have other commitments. So you always can say yes, and you need to make sure that whenever they refuse to participate, you need to stop collecting the data, or even use the data collected before lah. Because a lot of researchers ask, do I still able to use the data until when they withdraw from the study? So my answer to this is no, you have to, because the moment when they decided to withdraw, it means that they don't want themselves or even their data to be included in the study. So you have to remove this particular person from that study, even their data as well. And the other thing under this respect for person is to ensure the privacy and confidentiality lah, like how you do the anonymization, how you store your research data to ensure that this data will not leak to third party. Okay, then what you call that, and also the next important components is risk benefit analysis lah. So always, whatever study that you want to do, you need to foresee what are the risks, what are the danger, what are the possible harms to the subjects, and what are the benefits. Why do you need to do the study? What are the significance of the study? So you need to justify that. Okay, yeah, because you cannot just simply because I have the research question, therefore I want to carry out this study, then I just do it, right? Yeah, so you need to think far, what are the risks and how do you mitigate the risk. Then only the ethics committee will say, okay, so since you make efforts um uh to reduce the risk, or how you actually compensate if there's any injuries to the patients, like you come up with some insurance coverage plan, that help them to, to get some medical benefits if there's any injuries caused by the study. And last but not least, the principle of justice, and this is pertaining to the how the researcher actually they distribute the benefits and also the burdens among all groups or even the classes of the society, regardless age, gender, economic status, culture, and ethnicity. So like for example, you cannot just do the research because like for example, indigenous population. So because you think they are not very knowledgeable in that context, and they are easily convinced because maybe you just give them some benefits or some offerings, like for example food, then you can recruit them. So it's a no-no. So it's very important that you need to think about why do you need to select this group of people in your research. Okay, so you need whether this, like for example, if you want to do this study among the indigenous people, whether this is something that relevant to them, like maybe some disease which is more prevalent to that community, then only you do the study, which is justifiable. Like for example, even nowadays, I think a lot of researchers um when they decide on their eligibility criteria, they always think about they only get adults, and they always exclude pregnant women, for example. So, but then you need to think about if your study completed, like for example, if you are doing some drug study, so at the end, this drug is going to be used by this pregnant woman or those below 18 or yeah, youngster like children, then it is very difficult, it could be something very bad happen to them because this trial drug has not been appropriately tested among them. So you cannot draw the conclusion to say uh that this study has, produced good results. Yeah, so therefore you need to think about why do you select this population for your study. Yeah, that's quite important for you to understand lah. I I've seen some questions. Yeah, I will talk about this later. Thanks, Glory. Let me see whether still relevant, because otherwise I may want to skip to other. Yeah, just to mention, okay, maybe I think this is quite a few important information for you to understand also. So if you look at the GCP, it did highlight the responsibility of IRB lah. So yeah, for ethics committee, we are not only just give you the initial approval, but we also conduct continuing review, which means that whenever you got your approval, we are still continuously monitor all the projects. So therefore, we always ask you to submit your annual report, your progress report to us, and even you close the study, after the study completed, then we also want to know what exactly happened. And if there's any changes during the course of the study, like for example, if there's any deviation from the original protocol or any adverse events happen to your subjects, and all that need to be reported to the ethics committee lah. It's not only the regulatory authority like MPRA, they need to know this, but EC also want to know all this new information arise during the study. Therefore, when it comes to the authority of the ethics committee, so the ethics committee has the authority to approve, okay, to ask for modification, and we can disapprove, and in a way that we reject lah, the proposed study, and we can also suspend or terminate the study if um, even if your study has been approved, we still can retract or we can terminate the study if we find something quite severe happen to the study. And if we got complaints from the subjects, or maybe we received multiple severe adverse events from the hospital or whoever that reported to us, then we will also suspend the study, and then we will start investigating the root cause and all that lah. Yeah. So after the study has been approved and carried out, if you have any changes, then you also need to submit protocol amendments to us. Yeah. So the EC will also be responsible to approve or disapprove or ask for modification lah for all the protocol amendments. Yeah, I think I may not go through this one. You can find this video from our website. So this is basically just to introduce our composition in UMMC Medical Research Ethics Committee. So our chair is Prof. Louis, and deputy chair is Prof. Sharina. And these are the scientific members lah. And currently, I think there's a change. It's no longer Prof. Zhu, who is the deputy director of clinic or surgical team. Now I think it's Prof. Azura lah. Then we have all these senior members from different discipline. So these are the people mainly in our scientific team. And also we have the public representative and also the legal people in our group lah. So you can see this public representative, they are the advocates lah for the patients. And also for the legal side, we have this Prof. Grace, who is a professional in medical legal things lah. Now we still add on another member who is Prof. Sharon, also from our Faculty of Law, who actually advise us in the legal aspect. And also for our ethics committee, we actually have two subcommittees. So these are the various subcommittees that playing role after the study has been approved lah. So one is a subcommittee of site monitoring. So currently, I think we just changed the head for this subcommittee. This subcommittee is headed by Prof. Ng Chong Guan from psychiatry. So basically, they will do the site visit like audit lah. They will go to the site and see how the study has been conducted. They will check all the documentations, and I think especially those projects that involving elevated risk to the participants lah. Yeah, then we will provide our insights and recommendations for them to improve their conduct of research. And the other side is Miss Wong. She's our senior pharmacist from UMMC. So she's the one to help us to monitor all the adverse event lah. So not only for the drug study, but I'm sure for some surgical research also, if you are doing some medical device research, so we also want to monitor how this device or investigational product being used during this study, and whether it caused any issue to the human subject. Okay, so these are the two responsible subcommittee to monitor all this thing lah, all the studies. So besides our own ethics committee member, we also have a panel of external reviewers, because we understand the need of getting different experts to review different types of studies. So we get all these people in to help us as well. So these are the secretarial members. So these are the people that you always dealing with. If you have any issues of your applications, then they are the person that will help you lah. I think this is quite outdated one. I'm sorry. You can find the latest one on our website. Okay. So just a very brief lecture here. I think it's important for you to understand, after the study has been approved, there are still certain things that I think you have to do lah. So one is, I think for you, the most important one is progress report, because for all the study approved by ethics committee, we will send out the reminder for you to submit annual study report. For now, our IT system may generate automatic reminders lah. So 3 months before, or I think 3 times they will generate 3 reminders. So one is 2 months before, okay. Another one will be 1 month before, and the other one notification will be generated I think 2 or 1 week before the study expiry. So let's say your study is 2 year study, so which means before the second year you need to submit your progress report. Otherwise, if we find that you fail to submit the progress report, we may suspend your study lah, because we want to ensure that the study is still active. And they also need to tell us so far how the study has been progressed. Okay. Then if you have anything that, like for example, if there's a change of PI or maybe supervisors and all that, then you need to submit the amendments to us. And even the study has been completed, then you also need to inform us. We have all this actually, we have the format, the template for you to fill in, so you don't have to come up with your own reports. You just need to fill in, yeah, and submit it to us. Okay, and then number 4 to 4, 5, 6, and 7 usually is if something is not going on correctly, something is deviate from your original plan. Okay, and if the study terminated early also, then you need to submit us a report and tell us why is it early terminated, whether it is because the sponsor decided to pull out from the study, or maybe there are too many adverse events happen. So all these things we need to be informed lah. And even if we get any complaints from any stakeholder, so we will request for the explanation from the researchers. And as mentioned just now also, we will also need for those doing interventional study, you need to consistently update us if there's any serious adverse event happen to the subjects. Okay. All right, so this is a general workflow for all the studies. Okay, so for the secretarial staff, we will receive and manage all the document submission. We will vet through the document completion. If not, then we will bounce back to you and ask you to submit the complete application to us. Okay, then after that, we will decide whether or not the application is ready to be submitted to the next stage, which is our chair lah. So then after that, the chair or deputy chair, they will start classifying the submission, whether this study is classified as expedited review or full board meeting. Okay, so this is a very important, because for expedited review and full board meeting is quite different timeline. Even we always say for all ethics application, the TAT, the turnaround time is about 60 days from the date of submission. But for expedited review, usually it could be expedited within a month lah, about 30 days. But also subject to the workload lah, because sometimes we get like over 100 studies, and we may not have enough time to do this review. Therefore, it could cause a bit delay lah. And also, I also want to tell you that our chair and deputy chair, actually, they also our academic staff here. They are also the clinicians, consultant for the hospital. Therefore, I think sometimes it's understandable that they may need to spend their extra time to do all this review work. Therefore, sometimes it may cost slightly longer. In overseas, if you have happen to work in UK, US, actually in overseas, they have their ethics committee actually working full-time just doing review. They are clinicians, but once they join as a ethics committee member, they actually do this as their full-time. So it's very different nature lah. So the expectation also different. Yeah, because here sometimes we have researchers coming back from US and they feel our metric is beyond their expectation. Like sometimes we take about 1.5 months to finish the review process. So just to reiterate, because all our members and our chair, they are the academic staff and also the hospital staff here. So therefore, I think we also understand they need to cope their own commitments. Yeah, so for those fall under expedited review usually are the studies that uh not more than minimal risk. Like for example, you are doing some database analysis, you are doing some review study, you are doing some study that using retrospective data, okay, or retrospective biological specimen, for example, okay. But for those fall under full board meeting, usually those are the interventional study lah. For all interventional studies, like you want to compare whether this practice is better than the standard care, something like that. So whatever interventional study on invasive procedure, then it will all go to the full board meeting lah. Yeah, or even yeah, another main criteria for those being selected for full board meeting will be the studies that involve vulnerable populations. Okay. So once your study has been vetted by the chair or the go through the full board meeting, then we will get back to you lah on the decision whether it has been approved, whether it require modification, something like that. So yeah, once you got it back, then you can start doing your modification. You submit back to us, and bear in mind that we only will provide you 2 months to do your revisions. If 2 months later, is spelled out in our SOP. Like if after 2 months you still haven't get back to us for your revisions, we can remove the study lah. Means that you have to reapply a new application again. So just bear in mind that once you got the revision request from the ethics committee, please do your best to address those comments within 2 months. Okay. So and for this moment, we do not allow any appeal for those disapproved studies lah, which means whenever the ethics committee they reject your study, then you will need to come up with a new application. Okay. So and then after the meetings or the decision made, all this communication in between the researchers will be done by the secretariat staff lah. Okay. So all this communication, all this document submission, you have to deal with the secretariat staff. And it's a no-no for you directly email to our committee members, to our chair or deputy chair, because literally they have no idea head and toe, because we have a lot of students, they are doing last minute work and they keep pushing and they approach the chair, but the chair, they don't have idea, they don't know what is it about, because you just tell them the study name, and but they didn't receive anything from us. So everything must go through the secretariat, because we will be the one that tell the chair or the committee what they supposed to review, what they supposed to do. Yeah, so then only they can do a proper review. Otherwise, I think it's quite difficult lah, because we experience a lot from especially student project that they just write to the chair and ask the request for fast approval. So just to bear in mind that will even more delay lah for your study, because all this communication may confuse us, and eventually it will make things more complicated. Okay, so yeah, I think I have talked about this. I don't mind, I can share with you. There are quite a few more things lah. Yeah, I saw a lot of things that appear in the chat box. This is not so relevant to you. This is about the MREC program. Oh yeah, here. So you can actually find out more details from our website, ummc-mrec.org. Yeah, you can actually download all the forms templates from our website. And also, I think there are quite a number of these Q&A. Actually, you can find the answer from there. Maybe I can just show you a fast one. Wait, let me just share with you. So this is our website. So basically, you can see who are the people in ethics committee, and then yeah, so under apply, you can actually directly uh, go to the application system, which is the UMFC portal, and also you can download all the template forms from here lah. Yeah. Okay. So even your research protocol, we also have the templates for you, the participant information sheet. And also, yeah, I think from now on, also for all the studies in your department, you must get the comments from your HOD first lah. Then you need to submit online also. Before that, actually, is after submission online, then the online application will go to your HOD, then your HOD will give comments or approve, then only it will go to secretariat. But now we already changed the flow. We want all the researchers submit the form to your HOD with your research protocol or your research proposal. Then only we will look at it. Okay. So you can see all the forms is here for you to look at. And also the other important is FAQ lah. So it will explain some important information like what are the documents needed, how much you need to pay, okay, what is the turnaround time, okay, and what happened after the MREC approval. So these are all the important answers lah, because we know you will get all these things. Yeah, sometimes it's a technical aspect lah. After you fill in this, why cannot proceed? Okay. Yeah, I think I got
Yeah.
somebody hand
Yeah, me.
and yeah,
Yes,
yeah, yeah,
over
yes.
here. Yeah,
Yeah.
so just so that we address some of the ones who may not apply for because their site is going to be KKM, so it'll be NMRR. I just wanted to bring up the point that actually, if I'm not mistaken, MR they are the ones who used to have that form where the director of the hospital has to sign, right? So just like what you brought up now, that it needs to get approved by the HOD, and then they submit into the portal. So the ones
Mm,
that NMRR, the application, they have to do the same thing, but for them, it's the hospital director, not the
mm.
head of department. Yeah,
Oh, okay. So for
yeah,
KKM staff,
yeah.
they will need to get the director approval.
Yes, correct.
Oh, okay. I guess you
Yeah,
can use the same form. If you look at the form, actually the
yeah,
form there's two different space lah. One is by HOD and the other one is by the director.
yeah.
So for the students, I guess they can just get HOD and director. I mean for those from KKM
Oh,
lah.
yeah, exactly.
Yeah,
Yeah,
yeah, yeah. You can ask them to fill up for the HOD and make
yeah.
sure the director also sign that part.
Nice.
Then you
Yeah,
can submit to us and also NMRR. Yeah, yeah, I think I got 10 more minutes, but I think there are quite a number
you
of
can take
questions.
some questions. Yeah,
Yeah, yeah, yeah. Sure, thanks. I think you mentioned to get insurance coverage plan for your research. Yes, for insurance coverage plans, you can ask CIC or CRC. CIC is the one in UMMC, lah, our clinical investigational center, or CRC is mainly for those from KKM. Okay, but then I just want to reiterate here, you need to make sure that the types of the insurance also, because there are two different types insurance in general for research purpose. One is to cover the subjects, and the other one is to we call it as a indemnification lah for the researcher. So if there's anything that happened in the study, people cannot not say cannot sue you lah, but this insurance will protect you lah, something like that. So you need to ask CIC what exactly that you're looking at, you are looking for the insurance package. Do we need to apply for UM ethics committee approval if the interventional study take place in KKM hospital? Yes. Okay, so a lot of the students ask the same question. So yes, the answer is yes. Even your KKM staff, you have applied KKM and NMRR MRIC approval, but you still need to apply with us. The main reason is because you are the UM students, you carry the affiliation of UM. So it's important for our ethics committee also to oversee what you did for your study lah. Yeah, even sometimes you say you are not doing the study in UMMC, but in your own hospital. So, but you carry the affiliation as the UM
So how
researcher.
do they go about that? They still apply like for ethics approval, or they apply for a registration? You see, like if I'm not mistaken, last time if NMRR, like if you're doing your whole site is at UMMC, but if you're doing a trial, you can still register, I mean, still submit at NMRR at the registry, like how you would do for clinical.gov. So is it like now they register and or they still fill up a full ethics form, even though the site is not UMMC?
Okay, so it sounds a bit complicated, but yeah, you are right. If let's say they are doing their all their full research activities here in UMMC, so they just need to register an MRR, but not necessarily to get MREC MOH approval. The approval that they need to get is from UMMC MREC only. If their study is fully conducted here in
Yeah.
UMMC. But if let's say they
Other way
are
around?
just
Yeah.
only another way around is that if they are just the master students in UM or UMMC, but they perform their study in their own hospital under KKN, then they need to apply both. It's not
Oh,
just to
yeah.
register. It's not
Okay.
just register,
Ethics
because
approval.
for our
Yeah.
site we don't have the registry like NMRR,
Yeah.
because our site is ethics approval. So which
Okay.
means they need to definitely if they are doing
It's
this.
good that you brought this up, because I think then we need to remind our candidates.
Yeah,
It's actually something fairly new, right? It probably existed, but it was never highlighted like this
yeah.
before. Yeah. Okay.
Okay, so maybe I just reiterate, if you are KKM staff, but you are the UM student at the same time, you need to apply both ethics clearance. One is UMMC MREC, and the other one is MOH MREC. If let's say you are the students here, you are doing your study fully here in UMMC or UM, you only need to apply one UMMC MREC approval. And additionally, you need to register under an MRR. You don't have to apply ethics approval from MOH MREC, unless MRC MOH say you must. Yeah, otherwise we don't actually ask you to apply for that. You just need to register under NMR because you are the KKM staff. Yeah.
Another add-on is when it comes to the registering a study, the study designs are interventional studies only, prospective observational studies only. What happens if it's retrospective or database related? Do they still need to register it in NMRR?
Also depends on where they actually collect the data or the samples lah. Even it is a retrospective study, it is still the go back to the same way. It's just that where you actually, like for example, if you do some retrospective data analysis using UMMC data, so I think you just need to apply for our ethics clearance lah. I don't think even need to register with
Yeah,
NM,
no, yeah,
NMR. No
normally, yeah,
need.
I don't think
Yeah,
you
no need.
register for a retrospective.
No
Normally
need.
the registry, or it normally has to be some sort of trial. So it could be observational trial, but as long
Yeah.
as it's a trial.
Observational trial.
And it's prospective, and you are, even though you're just observing, it may be something which is new when you're observing. So then they still want you to register it. Of course, it's more definitely when it's an intervention which you're giving. Yeah.
Yeah, makes sense. Okay, apply annual ethics approval. The approval process is a similar but different link. NMR ethics approval is different from us. Yeah, I think if now, okay.
But the principles are the same, right?
Yeah, principle is the same, but I think at times people may get different sets of questions from different
Yeah, yeah,
ECs lah.
yes,
Yeah.
definitely.
I think you have
But
experienced that.
the
Yeah.
structure, yeah, the filling up, they still need the research question, was designed. They need the patient information sheet. All of that
Yeah.
is the same. The basic backbone is the same. But yeah, I agree. You
Yeah.
will be addressing different questions
Yeah,
for
more
sure.
or less it will be the same because like UMMC and MOH, we are being accredited by FROCAP.
Yeah,
It's like at our ethics ISO lah. So if we follow that FROCAP requirement, it's actually the same. That's why when you apply with UMMC MREC or MOH MREC, you will see almost similar questions lah. Maybe I think MRC MOH, they may have some extra questions
extra
lah.
questions. Yeah,
But
they
the
do have some
basic
extra questions.
information,
Yeah,
that they will be the same. Yeah.
yeah.
Mm. Okay. So
Do you
is
all have any
yeah.
other questions? This is just questions which I have then answered, and we're having discussion. You guys have anything where you've already tried applying and you are facing some issues which you want to clarify? You probably only have 2 minutes left, but
Yeah.
it's a good time to just ask something where you're having
Yeah.
issues and you don't know how to troubleshoot.
Yeah, before they ask question, I just would like to share one tip lah,
Yeah,
for the students, that you need to actively monitor your application status. Okay, yeah, the reason why is because there's some technical downtime of our IT system, and this system is not handled solely by us, but I think it's mainly handled by our IT department. So sometimes like after you submit the study, your payment has gone through everything, seems successfully submitted, but it has not actually. So I think the best practice is after you submit your application, please give us a call or email to us. You can find our information from our website just now. So please do call us or email to us to confirm whether your submission has gone through successfully. Sometimes even we notice, I know if you have submitted before, you will receive a notification email from MRIC say, from iResearch system say, oh, we successfully received, but actually it's not. We actually find that loophole recently also. We just a bit worried because you also have your timeline to catch. So it's a good practice if you just want to be very sure that your study has been submitted to us. Just do drop us an email or maybe just call us to confirm whether the study has been received. Okay. Yeah. Is there any other question? Very quiet now.
any questions? Have you all tried putting in an application? How many of you all here have aiming to submit or have submit? Okay, so how many haven't submitted anything yet and you're listening to it to know what to do, and how many of you all have submitted or going to submit and you're just here to get
Uh,
confirmation?
may I know, are they year one, year two, or final year?
I based on the names I'm seeing, I think I don't see any final year. They will be probably, I see,
First year.
yeah,
First
first year.
years.
Most of them are first years. Yeah,
Yeah, but I think it's good you should plan early because it take more than you may expect. Yeah, so
you want the
it's good.
approval. Yeah,
Yeah, I think it's
as
good
soon as
just
possible.
to, yeah, even your study may take about 1 year. If you apply in year one or year two, then after that, I mean, you apply for longer period lah, like
Yeah,
maybe three,
like
four
yeah, thinking
years.
about 3 year
Yeah,
duration.
yeah, because that process, because some students, when they want to do their research only, they start applying for ethics, and then
Yeah,
that will drag them quite some time lah. So
yeah,
the
yeah.
good thing is when you're not so busy yet, better you apply first, or you still have time to do it, then better you just submit it first, because it may take some time for you to address the comments and all that. So there are two layers, right? In ethics committee, first layer is by the secretariat. They may ask you a lot of in dealing with the completeness of your application.
Yeah, the
So that,
technical.
yeah, that would take a bit time also. And then especially if your study go another round with the chair or even the committee, then that would take even long time sometimes. Because sometimes it's not the ethics committee slow, Sometimes when we reply to the researchers, after 3 months only they reply. Then that application comes back to our ethics committee. Then again, it will take time for the research ethics committee to go through it again. Then it will be approved. So it will take longer than they expected.
So what's important there is, so just the two things I think Dr. Pang has brought up, it's important for you to monitor after you've submitted what's the status, because it doesn't actually send a reminder email. Sometimes it's a glitch. So it's best that you monitor and check whether there's anything which needs to be done. And if there's nothing moving in the system, you can always email in to check what's happening with the application. And once the comments come in, best to try and address it within the 3 to 4 days and submit it back, because that helps with it being approved faster. So it actually comes back to you guys addressing the changes as soon as possible. Yeah.
Yep. All right. Thanks.
Thank you. Thank you so much for your talk. If anything, I believe they know where you guys are situated and they know where to contact. They'll contact your team. Thank you so much. Yeah.
Yeah, thank you so much, Prof. Gauri. Thanks everyone. Yeah, thank you. Thanks.
Thank you.
Yeah, bye-bye.